Hi everyone, I'm Dr. Siddharth and welcome back to my channel Boon, Voyage, Diaries. Today we are going to discuss about a topic that is very common in every house. Yes, it's painkillers. Today in this video, I'm going to tell you what the painkiller does to your body, what are the side effects, and what are the necessary things which a person must understand before taking painkillers. Although it is the most commonly used drug, it is also the most misunderstood drug. So let's get into the topic and let's find out more about painkillers. What are painkillers? Anything that reduces your pain or reduces your sufferings because of pain is called a painkiller. In orthopedics, we have around five major subdivisions of painkillers. So those are NSAIDs, paracetamol, opioids, muscle relaxants, and other adjuvant painkillers like your pregabalins, which reduces your nervous pain. So before getting into this topic, I would like to give you a brief outline of all these drugs, all these subclasses of drugs, so that you can understand how they act and how you should benefit out of it. So the first classes are the NSAIDs, which are the most common class. The NSAIDs are non-steroidal anti-inflammatory drugs. These non-steroidal anti-inflammatory drugs acts by inhibiting the COX-1 and COX-2 enzymes. So there is something called this COX-1 and COX-2 enzymes which are produced, which can help you produce prostaglandins. These prostaglandins are the chemical pain messengers. Okay, so they are the messengers which send signal to the brain to cause pain. So once these COX-1 and COX-2 enzymes are blocked, the prostaglandin production is reduced or stopped, and thereby the inflammation is reduced and the pain reduces. So paracetamol also acts in a similar way, but it has a milder action compared to the other NSAIDs. NSAIDs are predominantly excreted through the kidney and they are metabolized in the liver. And NSAIDs usually don't cause any liver damage, but they can definitely reduce the blood supply to the kidney, reduce glomerular filtration rate, and cause kidney damage. Paracetamol, on the other hand, it can directly affect the liver and doesn't cause much of an effect to the kidney. So the next subgroup is the opioids. Opioids are a group of drugs that act on your brain and spinal cord, thereby directly blocking the pain signals. So once the pain signals are blocked, you guys are not going to feel any pain. So that is how these opioids work. The drugs include tramadol, tapentadol, morphine, all these work in similar way. The only problem with this is it is metabolized by the liver, so higher doses can cause liver problems, and it has a higher tendency of addiction, and it also has side effects like your drowsiness, lack of concentration, and withdrawal syndrome or withdrawal symptoms to be specific. The other group includes the muscle relaxants. Muscle relaxants acts by inhibiting the GABAergic fibers of the muscles, thereby causing relaxation of the muscles and thereby giving some pain relief. And the other adjuvant painkillers like your pregabalin, GABA neuron, all these things gives relief from your nervous related pain by inhibiting the neurotransmitters that cause pain. So this is a broad outline about the painkillers. So what are the side effects of these painkillers? The NSAIDs mainly cause side effects to your kidneys by damaging them, by causing reduced blood flow. They can even cause gastritis because it's a gastric irritant. Apart from that, your opioids, they can cause drowsiness, they can cause addiction, they can cause tiredness, fall in the elderly, they can cause confusion. They can even cause withdrawal symptoms and dependency on the drug, which further leads to a lot of problems. The muscle relaxants also cause dizziness, drowsiness, so it's advisable not to take before driving or working. So, how to take painkillers? This is the million-dollar question today. Is it advisable to take painkillers or is it not? If yes, how to do it? If not, What else can I do for my pain? So let me give you some tips and tricks to handle your pain. Never take painkillers without your doctor's advice. If you're taking NSAIDs, make sure you take NSAIDs on a full stomach and not empty stomach. Also remember to drink a lot of water when you take NSAID painkillers. Don't take painkillers for your arthritis and other muscle weaknesses continuously, because that can lead to a lot of side effects. Always remember, painkillers are like your fire extinguishers. Okay, you can have it in your hand and you can use it for an emergency. You don't use it to put out your gas, or you don't put out any other fire with your fire extinguisher unless it's an emergency. So painkillers must be treated in a similar way. Use it only when absolutely needed. There is no point in masking your pain with painkillers when the underlying cause is something else. So my advice is, go and diagnose yourself of the underlying root cause and treat it, so that you will be relieved of your pain without the side effects of these painkillers. I can actually give you a lot of examples of patients who are suffering from the side effects of this NSAIDs. I recently had a patient who was 65-year-old man who had an ankle pain for the past 3 months, and he was taking NSAIDs without prescription or even without consulting a doctor for the past 3 months. When he came to me, I found that he had ankle pain as well as abdomen pain and a lot of other symptoms. So when examined carefully, the person was suffering from tendinitis. And NSAIDs are not the way to go about in tendinitis. Instead, he could have had a small injection of steroid which could have sorted his problem, rather than taking 3 months of NSAIDs and later developing symptoms like gastritis and early kidney failure. So remember people, don't take NSAIDs for a prolonged period, at least not more than 3 to 5 days. Please consult your doctor before taking any NSAIDs. That is the best thing you could do to avoid the side effects of NSAIDs. I even had another lady who was like 40 years old. She had back pain for the past 3 months, and she was on her own medications of tramadol, which is an opioid analgesic. She was taking it for the past 6 months for her back pain. When examined carefully, she was having a small herniated disc prolapse and vitamin D deficiency, and she was on this tramadol painkiller for the past 6 months, which has in turn led her to develop resistance as well as lot of addiction. When tried stopping the drug, she had a lot of withdrawal symptoms like sleeplessness, irritability, confusion, and all those things. So she could have undergone vitamin D supplements if tested earlier, rather than taking a painkiller. The key isn't removing the pain. The key is to understand the pain so that we could treat it better, and we could treat the root cause so that the pain doesn't appear. So let me give you a few strategies which can be followed to prevent the side effects of your painkillers. So whenever you plan on taking painkillers or NSAIDs for your acute pain, try to combine them with physiotherapy wherever applicable, and try to use a topical NSAID like your diclofenac gel rather than taking a oral NSAID tablet. This will minimize your side effects. Always get your vitamin B12, vitamin D, and your calcium levels tested if you are suffering from chronic pain, because that could be the cause of your pain, and there is no point in masking your pain which arises out of vitamin D deficiency with a painkiller. Explore other options like your PRPs, hyaluronic acid, steroid injections for joints. Consult with your doctor and discuss all these so that you can avoid long-term side effects of the painkillers. And while using opioids, try to use them for a short duration, especially in acute pain conditions like your post-operative period or something, and try to taper them down as soon as possible so that you don't fall into any addiction or dependency for the drug. There are other home-based natural or supportive therapies that can give relief from pain in many people, like your omega-3 fatty acids, yoga, physiotherapy, turmeric, curcumin, and all those things can definitely give you pain relief to some extent and in some patients. So rather than using your NSAIDs or your opioids, it is better to go for these natural substances which can reduce your pain at times. Keep yourself busy, keep yourself active. Okay, there is no substitute for being active. Don't ever underestimate the power of movements, because once you lie down on a bed saying you have a pain, that's it. And that is going to be a disaster for you. Rather, keep moving, keep doing smaller things which can give you a mental satisfaction and a psychological pain relief to a great extent. And always remember, painkillers are not magic drugs, they are just a tool. And a tool must be used with precision to obtain perfect results. So please consult your doctor before using any painkillers, and always use your right tool at the right place at the right dose for a beautiful result. If you like this video, please don't forget to like it and share it with your friends and family. And do leave your comments below about any other interesting medical topics you want to discuss, and I'll do it for you. Thank you. Stay happy, stay healthy. See you in the next one.